Hyde joins us in New York. She's a deputy director for public partnerships at UNICEF and worked in Nepal for 4 years. Dominique, nearly 1 million children, according to UNICEF, have severely been affected. What is the greatest need for these children right now?
Thank you, Asye. The destruction caused by the earthquake has been devastating, as we just heard. Over 1.3 million children are in need of emergency assistance. We need to be bringing tents, we need to be bringing medical supplies, nutrition, and water, just even providing water to the families in Kathmandu and outside who are without water, without electricity.
But Dominique, how tough is it to do that, to get the aid to the people who need it the most, when the entire infrastructure has been destroyed? Roads are impassable, many bridges are washed away, homes are under mud. So how do you get the aid when you can barely get around?
Well, UNICEF already has over 200 staff in the country. Many of these staff are Nepalis. We've been there for decades. These staff have been affected by the earthquake. Their families have passed away or died, but everybody is working 24 hours around the clock to help the families. There are 16 informal settlements in Kathmandu. UNICEF has already been able to provide these 16 settlements with water and other supplies, and erecting some tents and for informal learning spaces, as well as psychosocial support for children. But what we are extremely worried about is outside of Kathmandu. And as you said, the roads are becoming more difficult to get through, and most of the houses have been destroyed, and we still haven't assessed the full damage of this earthquake.
Dominique, what about the hospitals? How many are actually functioning and treating patients? I mean, we're talking about thousands of people injured, up to 7,000, and these people need medical attention. Can these hospitals handle this kind of number?
As it was said earlier, when I used to live in Nepal, even then there wasn't enough medical care. So with an earthquake, the situation is even is more dire. What UNICEF has been doing is, with other partners, is putting in place temporary medical tents where we are providing immunization, where there are medical supplies being distributed, and medical centers in place. We're also concerned, obviously, for the nutrition of some of these children. Nepal is a country where malnutrition is very high, and with this earthquake, nutrition remains a grave concern.
And certainly UNICEF has covered and has been involved in many past earthquakes before. When you look at this one in Nepal, how does it, in your opinion, compare to the ones that we've seen in the past in Pakistan, in Haiti, and of course the one along the Indian Ocean tsunami disaster?
You know, I think it's very difficult to compare, but what I do know is that we had been expecting this earthquake for many years. So the United Nations, the government, everybody was prepared, had supplies in place, which have been helpful in the first 48 hours of this disaster. But I think you're never ready to see this scale of devastation. Some children have been separated from their families. We're doing our best to reconnect them with their family members. But obviously, children are always the most vulnerable. And we are concerned. Can you simply imagine what it must be like to be spending the night under the stars? And if it's raining, it's even more difficult. So we're bringing in blankets, we're bringing in shelter. And it's, I think, just extremely difficult days to come for Nepalis, but even years in terms of reconstruction.
Dominique Hyde, certainly a daunting and difficult but very important job. Thank you again for your time.